Start from where we stopped last time. This we had completed: history, itching, burning, known allergies, other symptoms, exposure to similar symptoms, immunization, and stress level. Then what to see? You should see the skin color, whether it is darker, whether it is lighter, whether some different color is there. So skin color is one of the major things we have to see in skin disease. Then the skin texture. Now the texture depends on many things. First is the cellular rearrangement, which I showed you last time, how the skin cells are arranged. The second is if the texture is dry, scaly, or whichever way it is. Then if there is any scaling, what you can do is you can take a glass slide, something which you keep under the microscope. So take a glass slide and you can see, just scrape the skin a little. So you can see if there is any scaling. Usually the scaling comes out just like you get dandruff. So white flakes will come out. So look out for the scaling. Press the part a little. So you will come to know the pressure. If the pressure is sensed or not sensed, that you will come to know. If there is any swelling, you will come to know. Then a little bit here and there, move your finger here and there, so that you will come to know if there is any elevation, because skin elevations can be very easily missed. So some pressure, then ask for sensation. Just press, ask for sensation. Look out if any function is gone. Function might be something like local function, or function might be something which is in systemic lupus erythematosus, जैसे पूरा body का joints का function निकल जाता है. Press and see if there is any oozing coming out, if there is any serum, if there is any pus, if there is any liquid coming out. And look out for old scar marks areas. कहीं और कोई स्कार है क्या आजू बाजू में, या और कोई बदन पे अगर स्कार है तो कारण पूछना चाहिए कि व्हाट इज द रीजन दिस स्कार, कहीं एक्सीडेंट हुआ था, मार लगा था, कटा था, जला था, क्या हुआ. सो ओल्ड स्कार मार्क्स इन द लोकल as well as the generalized area. Now I have shortlisted around 32 different skin diseases which are commonly found in general practice, which you will see very commonly around you. So we not 32, 30. So we will be discussing one by one. Actually, I wanted to finish 15 today, but let us see till what we go. So the first one is allergic rash. If you see allergic rash, you will have a history. Because it is an allergic rash, the patient may have a history of allergic rash. Patient will tell that this is a repetition, or I will get this every time in October, or I will get this every time in March. So it will be seasonal, and a allergic rash usually comes and goes. It will not progress. There may be itching, there may not be itching, there may be burning, there may not be burning. If it relates to some medicine, then you will have a known allergy of medicine. So ask for any medicine allergies. Many a times this allergic rash comes in coordination or comes together with angioedema. What is angioedema? I also have a slide for that. Ask for any current medication. There might be a current medication which is started, for example, sulfa drugs. So if sulfa drugs are started, you might get a rash like this, or a little bit blackish color. Ask for if there is any other symptoms. Allergic rash will usually not have any other symptoms. Exposure, nobody in the family or around will have an exposure. Immunization, there will be no relation with immunization. Stress levels also, there will be no relation. Skin color, it will be bright red, light red, or it may be a little bit blackish also. Here you see dots, but allergic rash may not come in dots. It may come as a generalized, localized area. So skin color is main. Skin texture, 90% of the times you will not find any textural difference. The skin texture of the rash and the skin texture of the skin will be similar. There will be no scaling, no pressure. Pressure will not exacerbate or ameliorate any symptoms. no problem in sensation, no problem in function. There will not be any oozing, and there will not be any scar marks. So, for allergic rash, a known case of allergy plus a repetition is one of the major factors with which you can diagnose an allergic rash. An allergic rash can come in any area. It might be there on the hands, on the feet, on the face, but the overall symptoms will be zero texture, zero pressure. There will not be any elevation, not be any texture differences. It is only that the skin color will change. Okay. So next is angioedema. This is what is known as angioedema. If you see the lips, they are like Sunny Leone. Sunny Leone के lips के जैसे एकदम बाहर आए हुए lips आ जाते हैं. So this angioedema is a swelling of the lips. Angioedema is a swelling of the lips. Majority of the time, it will be accompanied with allergic rash if the angioedema is related to a drug allergy. If there is any allopathic drug which he is taking, the drug allergy, majority of the times, the allergic rash will be coming with angioedema. So again here angioedema, if there is only angioedema, there might be dryness of the lips, or there might